So in layperson's terms, a trigger point is basically a taut band in a muscle, aka a knot, that can refer to other areas of the body. It can also cause some other issues medically too. It can mimic symptoms. Basically anything extreme that is placed on a muscle. So for example, overworking a muscle, underworked muscle, it could be from sitting down for prolonged periods, it could be from a trauma, it could be from bad posture. So there's a multitude of different things that can happen to a muscle that can cause trigger points to occur in that particular muscle. As I mentioned earlier, trigger points can cause other symptoms other than pain. So for example, they can cause issues such as dizziness. It can cause, for example, heart attack type of pain that goes down the left arm. You can have digestive issues because of trigger points. You can also feel headaches coming on too because of trigger points. But there's a multitude of different things that a trigger point can do. It can cause a lot of disruptions in regards to your physical self. So the common muscles that refer to the head as headaches generally are in the neck area, neck and shoulder area. So for example, in this diagram here, if you look real closely, there's this muscle at the front that we call sternocleidomastoid that can cause pain right around the front of the face, the top of the head, maybe above the eyeballs. There's a very common one, the upper trapezius muscle, which is the top of your shoulders here, and it can refer into the temple. So some people that have templar type of headaches tend to have very tight upper trapezius muscles. So those are very common muscles that tend to cause some of the headaches, but there's a lot more. So some of these muscles can refer down the arm, potentially into the wrist. So a very common one that I always see here in the clinic is the scalene's trigger point. The scalene's muscle is right here. So this is the front of your body, and what this muscle does is it refers into the chest, down into the arm, into the thumb area here at the front, and at the back it can refer into the shoulder blade, down the arm, and again on the thumb side of your hand. So that's a very common trigger point in regards to pain traveling down. So in regards to trigger points that may refer down the thigh, into the leg, potentially into the foot, the more common ones are in the gluteal or hip area. So as you can see, these pictures here, 1, 2, 3, 4 pictures here. Also 5, I guess. Like all these pictures down here, you can see that these trigger points come from the pelvic area, the glutes and the hips, and they can refer all the way down into the heel. For example, this little muscle here called piriformis, it can do a lot of disruptions in regards to pain down the leg. The one thing that I've learned over my years as a therapist is that regardless of what you may be diagnosed with, it doesn't necessarily mean that the actual pain is coming specifically from that particular diagnosis that you've been given. So for example, you might be diagnosed with osteoarthritis of the knee. There's going to be pain potentially, but a lot of times what I find is that there's trigger points in the area. My belief is that from what I've seen over the years, there is a huge component of muscular issues in regards to someone's diagnosis. So for example, somebody could be diagnosed with something digestive. They could have a digestive disruption, but there could be trigger points in the abdomen. There could be trigger points in other areas that can cause the person pain. So when I release the particular muscle that has a trigger point, what will happen is that a lot of the times the symptoms will fade magically. So remember, if you're diagnosed with a particular issue, it doesn't necessarily mean that you're sentenced to pain because of the diagnosis. if you come in to a therapist, to myself or whomever, and they can find that particular muscle that could be causing your issue, you may find that a lot of your symptoms fade. So in regards to stories of trigger points, I have a lot of them, but the one thing that stands out in my mind is people that have had prolonged coughs. Prolonged coughs can cause a lot of issues with the neck and shoulders, and also not to mention the abdominal area and also the diaphragm, the primary breathing muscle. When the neck muscles and shoulder muscles tighten up because of prolonged coughing, it can cause headaches to the side of the head, the front of the head. It can also cause referral pain down the arm. So what will happen is that the patient may not recognize that there's a link between their prolonged coughing and the symptoms that they have. Insofar as the abdominals, what will happen is that the person will complain of lower back pain. They get their lower back treated, but they aren't getting the results that they want. As soon as we start working on the areas that are very, very tight, such as the abdominal area, the diaphragm, that primary breathing muscle, the person's symptoms tend to fade. So that's just something to think about if you're encountering lower back pain, neck pain, or pain down the arm. Recognize that you may have had symptoms a while back that may be causing some of the muscular tightness causing